Yes. And
Say your name and spell it for me, please.
oh, that sounds legal, like I'm in trouble. Sandra, Sandra, Lopez.
It's just so I can A, get an audio on you, and B, know
Okay.
put the right spelling on your name.
Good.
Okay, it's your turn.
But you want me to look at? Okay.
Professor Lopez, how has your education here at the Graduate College of Social Work informed your career or prepared you for your career?
Well, I was a student here at the Graduate College of Social Work. At the time, it was the Graduate School of Social Work from 1978 to 1980, and I graduated in May of 1980. I can tell you that it was of great value that I was here at the program. I learned a great deal. My focus was on clinical practice. I was what they called a social treatment student. At that time, they had planning and administration and social treatment. And it really informed my practice because I knew that I wanted to be a clinical social worker of some kind. I wasn't sure what particular arena of practice I wanted to be in, but my field placement, more than anything, was very helpful to me. I was placed at Family Service Center and had a chance to work with children and youth in a particular neighborhood, and it was quite exciting for me, and that's when I really realized that I wanted to be a social worker working with youth. And so that kind of set a tone for my practice.
Can you talk about the importance of social work as a profession?
I really think that social work is probably, and I'm very biased, I must admit that, but I think social work is one of the most powerful professions in the world, primarily because of how we serve so many different entities of people. From, if you think about it, it's infants all the way up to older adults. So we cover the whole entire lifespan of any human being. And we're also represented in just about every helping agency that you can think of that's working with people, from juvenile probation to law enforcement to mental health, behavioral health, healthcare, school social work settings. I could go on, but I'm just trying to make the point that we deliver services across an arena of different practices. We're very diverse, and that's one of the most important things about the profession of social work. It also is probably one of our greatest challenges is in that many people don't understand what we do as social workers. I do want to think that we're doing a much better job as a college in terms of educating students and helping them to advocate for the profession and to be able to be the voice of what we do as social workers.
How does your work as a social worker make a difference?
As a social work professional or academician, we're going into both realms, that's right.
We are.
Yes. Is that okay?
Mm-hmm.
Okay. As a social worker, ask me the question again, please.
How does your work as a social worker and as a faculty member make a difference in the world?
My work as a social worker with that hat and also my academic or faculty hat informs the community in that as the social work profession, we help. We support those who are in need, and we help them to restore their capacities when they've lost or experienced some kind of damage in their capacity. And so we often work with their level of functioning, and again, across a variety of different settings. So being able as a faculty member to teach students how to structure an assessment process that really helps them to understand the greatest need that a client or patient has in a moment is probably a critical task that we teach students early on. In addition, many of our students then learn how to respond to the particular needs of the clients or patients that they work with, whether if they're in a medical setting or if they're in a mental health setting, still being able to follow a structured process and responding to the particular needs people have.
How will your students contribute to society?
Could you say, my students at the U of H Graduate College of Social Work, we're trying to brand it.
That's right. Okay. You know what's throwing me too is we didn't do an introduction.
I
Did
know.
you? So,
Can we do that?
Sure.
We never did. My name is Sandra Lopez. I'm a faculty member at.
okay. Let me do that now,
Can
and
we
then we
just
can
start
go
that?
back. Okay. My name is Sandra Lopez, and I'm a graduate from the University of Houston Graduate College of Social Work. It was the Graduate School of Social Work when I graduated in 1980. I am also currently serving as a clinical professor and faculty of the U of H Graduate College of Social Work. I've been here for 20 years as a faculty member, and 7 years before that as an adjunct faculty. Okay. So you can ask the question.
How will your students contribute to society?
Well, I believe that our students are prepared in our program to respond to the need of society based on their interest level. Of course, we have students that come into the program that are very interested in working with communities, and so those students very early on begin to create their own educational experiences through their academic elective choices as well as field practicum choices to work within the community so they can advocate, develop programs, do program assessments, just a variety of things that may be more in the community organization or macro side of the social work profession. We also have other students that are prepared for doing clinical practice and to respond to clients and patients, again, across a variety of different arenas, like healthcare as a medical social worker, or in an inpatient psychiatric hospital working with patients that may have mental health issues, also working with youth in a juvenile probation center, or working in an adolescent residential facility. So our students come here and learn skills and knowledge to help them in working with people in general. They learn about human behavior. They learn about developmental stages of life. In treating or working with populations, they learn about trans-theoretical approaches that allow them to select theories that are going to be most appropriate for clients at a particular point in time.
Another thing that
What would our community look like if there were no more social workers?
Okay. If there were no social workers in our society, and I'll just deal with it in very simple terms, think about infants that come into the world that may be born with certain high-risk issues, and the parents are likely grieving and dealing with the loss of a normal or ideal child, and they're connected to an intensive care unit in a hospital setting. If there were no social workers there to provide support to that family, that likely would create a crisis. Take it a step further to that infant who might go beyond their experience of having medical complications and then would go into a school setting. And who would be there in the school to help the child if they had any kind of an experience? Let's say they had attention deficit disorder and were participating in disruptive behavior in the classroom. There may not be a social worker to advocate for that child in helping the educator or the teacher to understand what might be impacting that child's life at that moment. Children that are in classrooms that have a parent who died, or that have a parent who's dealing with some kind of terminal illness, or that may be dealing with the fact that a family member has been incarcerated or has a substance abuse or addiction problem. Who would be there for that child to support them within that school setting, whether it's elementary, middle school, or high school? Think too about some of the tragic experiences that have happened around our country, like in Newtown, Connecticut. If you think about that, the people who usually respond in those situations tend to be the social workers, the school social workers in those communities that provide help to the children and to the parents, to the families, the overall community there surrounding the school, that work with them in terms of responding to the crisis as well as dealing with the grief issues and the trauma issues that impact those folks. If you take, again, the developmental stages of life from infancy all the way to older adults, you can see clearly that social workers are involved all the way from hospitals to schools to colleges to community organizations to other settings like mental health where people might be reaching out for services, mental health agencies, college settings where they might be providing support services in a counseling center, social workers, if they were not there, likely would create a deficit for people in our country because they would not have a place to go. There may be other professional groups that could render some help, but my point being is that there are a lot of social workers in the country that are serving that vital need of responding at that first gatekeeper role to those children or those older adults and other people in between. One of the very exciting things that the U of H Graduate College of Social Work has been involved in the last few years is a National Child Trauma Collaborative Project, and I've had the opportunity and honor to work with this program as the director of the project. What it has involved is that we are working alongside 8 other graduate schools of social work around the country, and primarily our goal is to enhance the education of social work students in the arena of trauma treatment, especially relating to children who've experienced some form of trauma. When we think about trauma, we're talking about experiences, for example, sexual trauma. A child may be sexually abused by a perpetrator. Sometimes it may be someone within their own family system. It may be a child who's experiencing domestic violence within their home. It may be a child who's experienced some kind of sexual assault outside of their home or within their school setting. It may be a child who's experienced some kind of traumatic death of a loved one, a parent, someone within their family system, and they're dealing with the grief and loss of that experience. In trauma, what we've learned is that there are not enough social workers in the country that are really educated in the realm of trauma, and there's definitely a workforce issue. What's very critical and what has been behind this project is that when you look at all the services that provide counseling and therapy to children who've experienced trauma, about 80% of the service providers tend to be social workers, yet not very many social work programs within the country have been offering programs or courses that help the social work students to learn how to work with these children and to do treatment. So U of H has been involved in this project, as I said, and what this has involved is that we chose trauma-focused CBT, trauma-focused cognitive behavioral therapy, is the trauma treatment approach that our students that were selected in this project would learn and be trained in, and then have an opportunity to apply the approach with children in their field settings who've experienced some form of trauma. In the first year, we had 4 trauma fellows that were selected, and that was in the fall of 2011 to spring 2012. And then in this last year, from fall 2012 to spring 2013, we had 11 trauma fellows who participated in the project. They then are placed in agencies around town who are working with children and adolescents who've experienced some form of trauma. Through the 9 months field practicum, the students then become more proficient in the use of a trauma-focused CBT approach and become more comfortable and more competent. So we believe that through this project that then students, when they graduate, are able to enter the workforce and to be able to hit the ground running within their settings wherever they're employed, and to be able to apply this particular approach in working with children and youth who've experienced trauma. We know already, for example, that many of our fellows are in high demand by settings that are working with children and youth who've experienced trauma because they're looking for clinicians who are well trained, who can work with these kids and know how to help them to heal from their trauma experiences. What makes the Graduate College of Social Work so special is that I believe that we tend to be very strong in our leadership. What I mean by that is that when the college recognizes that there is a need, whether it's in our community, locally, statewide, or even nationally, that we are oftentimes the very first and tend to be the pioneers in accomplishing some of the things that need to be undertaken, especially within the social work profession. One of the examples that I can give has to do with the concern about how social workers are impacted by their work. Over time, within the last 10 years, there's been more and more research showing that social workers across a variety of settings, it doesn't matter what setting, but that we are impacted by the work that we do. Many times we experience stress, burnout, compassion fatigue, secondary trauma, or even vicarious trauma. Here at GCSW about 5 years ago, we were the very first college in the nation that created a course called Professional Self-Care and Social Work, which I have had the honor of teaching over the last 5 years. And so our students, I think above many, many other students in the country, early on learn that they must practice self-care and that they must be very diligent in that process and be aware of how they're impacted by their work. There are other things that we have shown leadership in within the College of Social Work. My discussion earlier about the Child Trauma Project is another example. We're one of very few colleges within the nation that has been involved in this project and that has a full educational model that teaches students about child trauma. In addition, we're one of the very few colleges, or graduate programs I should say, within the country that has a course related to trauma and social work practice. So we're definitely leaders across the country and recognized for our leadership, whether it's advocacy for the profession or definitely preparing our social work students for what they need to know for working with the community. Okay.
To leave. So,
Mm-hmm.
could you speak to the biggest lesson that you've learned as a teacher of students? What have you learned from the students? What have the students taught you?
Let me think on that for a second, because there are a lot of things they've taught. One of the things that students have taught me over the 20 years that I've been here as a full-time faculty is that they come into the program, and the majority of them come in with such a compassion and such a heart to do the work of helping people. And they teach me constantly with their compassion and with their enthusiasm that we are vital to working with people in our community, and that staying fresh and staying strong and being compassionate and passionate about the work that we do is so important, not just for the practice of self-care and reducing vicarious trauma, but to remind us about why we choose to do this work. So whenever we have, I want to say, fresh beginning students that are coming into the program and foundation, through their smiling faces and their enthusiastic conversations when they begin to talk about what they want to do and what they hope to do upon graduation, it tells me that that spirit that they bring with them and their positive values, their sense of helping, their staunch advocacy skills already from the beginning will make them impeccable social workers. And so they rejuvenate me. They teach me so much about what's vital about the community and what the needs are about the community. And I really believe that many of us as faculty stay open to their fresh ideas, and they teach us how to become more effective faculty and how to stay abreast of what's happening in the community.
Name and spell it for me.
Susan Robbins, SUSAN ROBBINS.
It's all yours.
Can you state your name and your title and your connection to GCSW?
Yeah, I'm Susan Robbins. I'm an associate professor at the University of Houston Graduate College of Social Work, and I have been here since 1980.
Can you talk to us a little bit, Dr. Robbins, about the importance of social work to communities, to families, and even to individuals?
Social work is the only of the helping professions that really has a very, very broad perspective and is apparent in many different fields of practice, including clinical practice with individuals and families, as well as organizational development, community development, and political social work.
Can you talk a little bit about your work and your research and how it makes a difference and how it impacts social work?
Yeah, I think that my work that has made the most difference is my human behavior theory textbook, which is now being used nationally and internationally and is one of the best-selling Allen and Bacon titles. When I first came into social work, we had a very narrow psychodynamic perspective that was then augmented by systems theory, and my book has really broadened the theory field for social work.
Can you talk about some of the leadership activities and qualities that are among the faculty at the Graduate College of Social Work, including your own?
We have lots of leadership here. I can speak more so to my own. I'd rather have other people speak to theirs. My leadership in the college has primarily been in the field of curriculum. I was one of the 3 people who designed our, what is now no longer new, but we call it our new foundation, which is a one-semester foundation that uses what I'm going to call out-of-the-box thinking. It's not like anything that exists anyplace else, and it is now receiving a lot of attention nationally. The other area in which I have shown leadership is that I'm currently the editor-in-chief of the Journal of Social Work Education, and that gives me a chance to review many manuscripts and publish the best, make choices about the best, as well as write what I hope to be considered very important editorials.
Dr. Robbins, can you talk about?
You can go whenever you want.
Were you already answering, or is it on me? I think
It's on you.
Okay. My turn. Let's see. Oh, okay. Can you talk a little bit about the students at GCSW? What makes them special? What have they provided to you throughout your tenure here?
Okay, let me stop. That's not a good question.
Okay.
How about the contribution that our students make?
It's good. Good. Can you talk about the contributions our students make to communities?
Our students make incredible contributions in a variety of fields.
Go over you.
Okay. And give me a second to think about my answer for this. We have totally awesome students. They provide a variety of contributions in a variety of fields in social work. They come in here primarily wanting to be do-gooders, and we turn them into good doers. And I think that makes a very big difference, because they go out there and they do good work in the community with individuals and families and in the political sphere.
Why should people financially support the Graduate College of Social Work?
I think financial support is critical, particularly at this point in time. We've had massive state budget cutbacks, which then leaves it up to the colleges to raise money on their own. Scholarships are certainly a very, very important area, not the only area, but a very important area, because the cost of education has gone up dramatically, and the cost of student loans is, people are just wallowing in student loans. In addition, there are other things that can help the college succeed as well in terms of research, adding to, you're going to have to edit that out.
Okay.
That's good enough.
Okay.
Is that okay?
Yep. Can
Do you want me to-
talk about, I don't know, Connie, what would you,
I wanted to, we had this one about what makes the GCSW special, or what do we contribute as a college, city, state, nationally? You can
Yeah,
include at any level that you want to. Is there anything that sets us apart, or anything that means, that if we weren't you, what's the impact that we have as a college?
That's a really good question.
Okay.
I know that Ira doesn't like people singing his praises, and he has had a major impact. Is that okay to say something about him?
Mm-hmm.
I think that would be great.
Yep.
Nobody has.
Okay.
Mhm.
Oh, really?
Mm-mm.
Okay. Give me the question one more time.
What impact does the Graduate College of Social Work make on the community?
We make a tremendous impact on the community and the state and nationally as well.
Say UH Graduate
Okay.
College of Social Work.
Okay.
Makes a tremendous.
Okay. The University of Houston Graduate College of Social Work makes a tremendous impact locally at the state level and nationally, and now internationally as well. Dean Colby is truly a dean of vision, and he has set very high bar for our faculty to meet, and we have met that and continue to meet that. The college keeps going up in rankings. Our publications are very well known. I just blanked. I'm sorry.
That's fine.
Let me try that again. Give me one
Okay.
second. Give me 1 second to think this through. Okay. The University of Houston Graduate College of Social Work makes a tremendous impact locally, statewide, and nationally. Most particularly, Dean Ira Colby is a leader of vision, a true leader of vision. He is now the past president of the Council of Social Work Education, our accrediting board, and he has initiated endeavors overseas as well, particularly in China. We now have a very active study abroad program, which broadens our students' perspectives and lets other countries get to know us better as well. We have top-notch researchers here who are making an impact both locally and nationally. And certainly our students, as they go out into the world of practice, will make an impact on the community.
Ask you, tell us why you feel it's important to lend or to give financially to the Graduate College of Social Work.
I thought I already covered that.
Well, we have one question. If you covered scholarship, maybe you did. This question was well put by Connie. She said, with so many other worthy,
Hey,
you
give me
feel
a
like you've
second.
already said that.
In addition to the need for scholarship money, funding of the University of Houston Graduate College of Social Work is vitally important to carry on the work that we do here. It's important to keep in mind that our graduates, social workers in general, and our graduates in particular, provide the majority of mental health services in the city of Houston and other places where they may live.
Thank you. Between one and two.
Before they get started,
Mm-hmm.
please say your name and spell it for me.
Luis Torres, Luis Torres.
Yours, ladies.
Okay. So first, can you start by stating your name and your title and your
Sure.
connection?
I'm Luis Torres. I'm an assistant professor in the University of Houston Graduate College of Social Work. I am now completing my 5th year, so this coming year I'll be going through the tenure process, so I'm excited about that.
Can you talk to us a little bit about the importance of social work?
Well, social work is a discipline that is critically important because it has the ability to bring together many other disciplines. By training, I'm a clinical psychologist and I'm a faculty member in a graduate college of social work. And it's because I believe that the challenges that the communities that we work with are facing are very, very complex and very multidimensional and can rarely be addressed or explained or understood through a single lens. And what social work is able to do is to bring together the perspectives of psychology, of public health, of medicine, and through the framework of a person in his or her environment, really begin to understand some of the root causes of the problems of our communities and really begin to come up with creative solutions.
Can you talk a little bit about your particular work and your research?
Well, I like to think of myself as somebody who comes at a problem from multiple angles, and my research agenda is primarily on Hispanic families, Hispanic communities, and I work with Hispanic communities both from a problem perspective and from a strength perspective. From a problem perspective, my research is on co-occurring drug use and mental health and medical disorders, particularly HIV and AIDS and other conditions that communities of color or Latino communities in particular are disproportionately impacted by. Right now we have a study funded by the National Institute on Drug Abuse that is looking at heroin use in Mexican American communities, health consequences of long-term injection heroin use, looking at the mental health consequences of the health consequences, the deterioration of the family, and what are some of the factors that lead to those kinds of problems and how can we address them in a holistic way. At the same time, I'm involved in various research projects that are dealing with family strengthening in the Latino community, a fatherhood program that's looking at characteristics that make fatherhood programs for Latino men culturally grounded or culturally relevant, so that the Latino men are going to want to participate in those programs, and program evaluations that look at healthy relationships or family strengthening initiatives. So I look at the Latino family both from the lens of here are some of the challenges that this community is facing, but also from the lens of here are some of the strengths of the Hispanic or Latino community, and family is one of the largest strengths of the Latino community.
Just to switch gears a little bit, can you talk a little bit about the importance and the impact of the bilingual scholarship
Sure.
program?
Well, one of the key factors that attracted me to the University of Houston Graduate College of Social Work was the diversity of the student population. When I first came to interview, it just felt like a nice fit. You know, I am originally from Puerto Rico. I did my PhD in New York, so I'm used to being in multicultural communities, and the University of Houston being one of the most diverse college campuses in the nation certainly felt like home. I also learned that the undergraduate student population, over half of them at the University of Houston were first-generation college goers. And that's something that we also see reflected in our graduate students. You know, many of our graduate students were undergraduate students at the University of Houston as well. So they're also not just the first people in their families to go to college, but then moving on to a graduate education. So that really attracts me to it. Last year, the University of Houston was designated a Hispanic serving institution, which means that at least 25% of our student body are Hispanic. And that creates enormous opportunities for us, but also enormous challenges, because that means that we're surrounded by Hispanic communities that have cultural differences, linguistic differences from the majority of the providers that are present in those communities. So we have, in the Graduate College of Social Work, various scholarship opportunities for bilingual students that want to train and then go out and work with these Hispanic communities. And I'm one of the faculty members that's involved in interviewing and selecting the best, the most qualified students to receive those scholarships. And it's a wonderful way to impact our communities in two ways. One of them is that the students come from those communities. So by improving the education and the skills and the training of folks who come from those communities, we're increasing the capital, the social capital in those communities. But then we're also sending back people who are highly trained to help address the problems of those communities from within.
So we're going to ask you to put on your salesman's hat.
Mm-hmm. Sure.
So with so many worthy causes, why should somebody financially support us?
Well,
Want to change the framing a little bit?
sure. Oh, I moved a little bit. Thanks, Phil. Well, there are many different reasons why you should support us. One of them is, as I was just saying, you get double bang for your buck. Sometimes when
Don't say as I just saying, because we may not
you may not use that. Okay.
Just say.
Gotcha. There are many reasons why somebody might want to support our college over other worthy colleges, and one of those reasons is because you get a double bang for your buck. When NPR or other types of organizations are doing fundraising, there are certain days when your money goes twice because somebody makes a donation, for example. Many of our students come from the same communities that we're trying to help and that we're trying to support. So when you support a graduate student, a Latino student, an African American student, an Asian student that comes from vulnerable, needy communities, you're actually supporting that community up front by increasing the capital in that community. But then at the tail end, you're then sending somebody back into that community who's highly trained culturally and linguistically and with the skills to really make a difference in addressing the challenges of those communities. So it's a win-win. We're also the only graduate college of social work in the greater Houston metropolitan area. And 80% of our graduates remain within 50 miles of Houston. So your money stays here. It stays in this community, and it makes a difference.
That was.
Sure. Here at the University of Houston Graduate College of Social Work, we have some phenomenal students. Many of them are first-generation college goers. They're the first people in their families that ever went to college, that completed a graduate education, and that are going back. They're remaining in their communities and making a difference in the communities. These students often went to schools where they didn't get the best education. They weren't the best funded schools. They didn't get the best skills. So they come to our college with some gaps. There are some gaps in their preparation, and oftentimes faculty has to work with them to address those gaps. And they catch up very quickly because they're very bright students, but they also come with what I would call deficits in confidence. You know, when you're a minority like I am, when you've grown up in a vulnerable community like I did, you know, and when you were the first in your family to go to college like I was, you often second guess yourself as you go along the way and wonder, do I really belong here? Do I have what it takes? Am I as good as some of these other people? And you know, I know now that the answer is yes. But when I was going through that journey, there were many times when I questioned whether I belonged there and when I almost said, I'm giving up. And it was thanks to some of the faculty and some of the mentors that I encountered along the way, some of the sponsors who donated to the programs where I was studying so that scholarships could be extended to me, that I was able to find my voice, to stay the course. And today I'm a faculty member, you know, and I'm paying it forward. I'm mentoring other students that are going through that same journey.
Could I ask you to say your name for me and spell it?
Rosalind Rolls, Rosalind Rolls.
So yours, ladies.
Okay. So if you could just start out by stating your name.
I'm sorry, do I just always look here? Always look at the camera?
Look around here.
Yeah.
Okay. Okay.
So if I could just have you state your name, your title, and your connection. And here's where you might want to talk about being president of.
Okay. My name is Rosalind Rolls. I'm a 2009 graduate of the University of Houston Graduate College of Social Work, and I'm also the current president of the Alumni Association and its board of directors.
Ross, can you talk a little bit about how the GCSW education informs your current career? And you might want to say what you do now.
Okay. I'm currently the outreach coordinator at Goodwill Industries of Houston. I work specifically on a veterans program that provides housing assistance to homeless veterans. And my education at the GCSW is definitely evident in the work that I do. My focus may be more administrative, but I'm able to work with my supervisor and upper management to develop programs and systems and improvement to programs that allow us to better provide services to our clients. And that's a big part of the education that we get at GCSW, not just service delivery, but providing service to a level of quality that meets the needs of the clients, the agency, and the community. So I definitely feel like all that I learned, all that I took in class is being manifested in my work.
Can you talk a little bit about the importance of social work?
Okay.
I guess we'll ignore it because Dean's not here and these are.
Is that his phone?
Okay. Social work is extremely important. Social workers, it's really a career path, but it's also a perspective from which you see the world and your environment. And I think that is key in a city here in Houston that has an extremely diverse population, a very active and robust social service community, but to have social workers that are involved in agencies, involved in communities, and involved in leadership to provide that perspective to really provide justice and advocacy for those who don't have a voice, for those who can't do that themselves. And that could be anywhere from a single mom struggling to meet her needs from day to day to an executive who may need coaching on how to lead his organization more effectively and efficiently. Social workers can do that, work with individuals, work with organizations and agencies, and everywhere in between. And so it's extremely important to communities.
Let's see. Can you speak a little bit about what makes the Graduate College of Social Work special?
There's a lot. No, I know there's a lot of different ways.
If you would say UH Graduate
Okay.
College of Social Work.
Okay. I feel the University of Houston's Graduate College of Social Work is special and important because of how it challenges students. I know when I came in as a student, very fresh and still myself trying to figure out what is social work and what does it mean to have teachers who really forced me to challenge my own thoughts, to challenge my own biases, to really take in the feedback and contributions my fellow students were making. I thought that was absolutely invaluable. The group work assignments where we're forced to listen to each other, hear each other out, and then come to a consensus. It's really modeling the work you're going to do out in the community, because when you go out, you may be the only social worker in your agency, or you're the only social worker on a committee. So you're really learning how to be a social work practitioner from the very beginning of your education here at the GCSW, and I find that absolutely priceless.
Can you talk a little bit about your experiences as the president of the Alumni Association, your interaction with the alumni, other alumni, and just kind of how, let's see, where am I going with this? The importance of kind of staying connected, how you guys managed to do that, and staying connected to the college.
Okay. Well, in my role as president of the Alumni Association, it really has a twofold benefit. I get to be involved and engaged with alumni, people who've graduated from this school who have the same sensibilities as I do, while also staying in touch with the school, keeping a pulse of what's going on with students. And they're both rewarding because we have alumni out there who are doing some incredible, incredible work in their agencies, in the community. And then again, to be a resource for students has been so rewarding, for students who may not be clear about their career path or want some insight about a particular course. That has all been so very rewarding for me personally, and even as I talk to some of my other board members, they are feeling the same way. That connection of being in the Alumni Association has really been valuable.
So with all of the charitable organizations and worthy causes that people could invest in, why should someone invest in the Graduate College of Social Work
Oh, wow.
at the University of
Mm-hmm. That's a good question. How do I articulate that? Let's see.
One of the places we'll use this video is at the luncheon.
Mhm.
So it's the luncheons for scholarships.
College of Social Work.
Okay. I think investing in the University of Houston Graduate College of Social Work is so ideal and so important and such an opportunity. Students come in at this level, higher education, graduate degrees. Resources for funding that education become fewer and far between, and then that really creates a hardship while you're a student, and the stress of maintaining your studies and being involved and also covering the cost of the education. And then as a graduate, when you're out there actually beginning your career as a social work practitioner, and then also facing possibly more debt than you anticipated. Higher education is not getting any cheaper, and to really practice at a level that is of quality and true advantage to the community, this type of education is important. It's a pity when it also becomes a burden. So for those out in the community that can invest in the Graduate College of Social Work, it is truly an opportunity.
I don't know if you can speak to this, but I think this is kind of important in helping people to understand social work. So can you touched on something about the perspective of social work. So can you talk about the perspective more specifically and how that helps social workers help people and help communities? Does that make sense?
Mm-hmm.
Do you think you could talk to that?
Yes. Yes. Okay.
Do you want me to ask the question?
Yeah, say it again so I can do the lead in.
Okay.
How do I lead into it?
So how does a social work perspective, so what value does a social work perspective have when it comes to helping individuals, families, and communities?
Okay. In terms of helping individuals, families, communities, social work values and ethics are so important. To social workers, we believe that everyone deserves dignity, everyone has worth, everyone has the right to be involved in their own process of healing. We don't dictate to our clients and those that we work with. We really do see it as a synergy. We practice from a sense of empowerment. And everyone should have that voice. Everyone should have someone that is fighting for them when they're not strong enough to fight for themselves. And that is so key. Those are some of the essential components of social work and what makes us different than some other helping professions, and how we really do provide that different perspective when we go into agencies, when we go into communities, when we practice one-on-one with our clients. Those are all important factors of what it is that we do and what it means to be a social worker.
Did you have anything, Colin? The things you may have learned from faculty? And if there's I know it's a hard question, but if there's kind of the single greatest lesson that you learned here?
Oh, yeah. Okay.
Or I know that you learned a lot from Dr. Ladding.
Yeah.
If you could speak to some of that. I know we chatted about that before in passing.
Mm-hmm.
Any of those things.
Yeah. I mean, okay.
So I'll kind of frame
Yeah,
it.
say it again.
Okay. So I'll kind of frame the question as, what is one of the greatest lessons or biggest lessons you learned while a student here at the Graduate College of Social Work?
Okay. There are two very important lessons that I learned while being a student at the University of Houston Graduate College of Social Work. One is independent thinking. Being able to receive information, process it, and walk away with my own thoughts, and being able to articulate those thoughts even if I may be the only person with that particular thought. And knowing that that is okay. And that really leads into the second question, is being fearless, because sometimes you do have to stand up for what you believe is right, whether it's advocating for an individual, a family, the agency where you work with, the population in the community, and being able to stand up and fight for those, again, who don't have a voice, who may not be strong enough to fight for themselves. So I definitely feel like the Graduate College of Social Work really, more than my undergraduate education, really began to shape the adult and practitioner and professional that I am.